Okay, hi, my name is Christina Aguilar, and with me today are my three interns here at Advocate South Suburban Hospital in Hazel Crest, Illinois, in the United States. So if you all would introduce yourself, we'll start with Jacob.
My name is Jacob Multack. I am finishing my master's degree in clinical psychology at Governor State University.
Hi, my name is Felicia Mitchell. I am an intern at Advocate South Suburban Hospital. I am currently a master's degree program student at Aurora University.
Hi, my name is Alejandra Soto. I'm a student at the University of Chicago, finishing up my master's in social work in a pathway of mental health, integrated health, and social care.
Thank you. So today, what we will be sharing with you about is utilizing solution-focused brief therapy on medical units and in crisis settings, because that's what we have been doing over the past year. In fact, the three individuals here, my interns, have been doing that. I know that Alejandra and Jacob have completed the training and have been doing the therapy, and then uh,
Felicia.
Felicia, why am I forgetting Felicia's name? Felicia has just started training. So all of them will be sharing about their experience and where they're at in the training and so forth. But we will be talking about just just how we started, what we do, and how that's been working for the patients and for the students and for everyone that's involved in what we're doing over here. So we're going to get started talking about that. Okay. Let me pull up our thing. Oh, look, my sharing's paused. What did I do, guys? Here we go. Okay. Uh-oh, you guys, I did it again. Oh, I'm going to have to share again. Here we go. All right. I think I have a little bit of a problem with my technology, but here we go. Okay. All right. So as we just said, I would just want to tell you a little bit about myself. So I'm a licensed clinical professional counselor in the state of Illinois. I also am a drug and alcohol abuse counselor. I've been doing both of those for over 20 years. And I have also been working in crisis work in hospitals in the last 15 years. So I have personally decided, and we were just talking about this, I was talking with the interns before we started this presentation. We were just talking about why I, started using solution-focused brief therapy. And I think it was because it was just me in a hospital, right? I was the crisis worker. And so when something happened, I was having to go from a ER to a med floor to another floor to the front of the hospital. And, there wasn't enough time to do some of the more, if we put in quote, traditional therapies. And so when I looked into solution-focused therapy, and or brief therapy, it was something that was able to accomplish so much more in a short period of time and appeared to be something that was very effective. And so 12 years ago, I started to apply that. And then as I started to get interns, I said, hey, let's make this bigger. And we're going to talk a little bit more about how this grew. But now I am the lead psychiatric crisis therapist over here at South Suburban Hospital, and that's how we started to grow this. So one of the things that I want to make very clear as we talk about this is that I know a lot of you that are watching this today probably already do use solution-focused brief therapy, but some of you may not or may be curious about solution-focused brief therapy and may be wondering, how or why it would work in a medical setting. Um, For me, I believe that it is perfect for a medical setting. One, because we have a very short period of time to work with people. Many people come into the hospital and they're here for a short period of time, usually less than 5 days. Also, when people do have maybe an emotional crisis in a hospital, which happens more often than people may be aware, there is not that much time for us to spend with the individual, or even have that identified for us to come to meet with the individual. So this therapy, this intervention fits and matches that need. So I wanted to look at some of the scientific research that's been done specifically with solution-focused brief therapy and in doing it in medical settings. So Zhang and in their research said that solution-focused brief therapy had significant statistical evidence that showed that intervening with this therapy was helpful. Now, as we know, the body affects the mind affects the body. So if we are intervening on one and not intervening on the other, we're not being very helpful. So if we're intervening on both, that's giving such a synergy that it is helping the individual more. Another study is from Rahman and McMillan. This is from a nursing study. And so this study, what they came up with is that it fosters a sense of agency, hope, and practical solutions. I think we need to focus really on that second word, hope. As we work with our patients in a hospital setting, many of our patients come without that word because of socioeconomic situations, because of family situations, because of perhaps they're struggling with a psychiatric situation or a substance abuse situation, or they may have a terminal diagnosis. So they feel they have lost hope. They feel they have lost, if we go back to the other word, agency, they have lost control of their life. And so when we use solution-focused brief therapy, we are helping people gain that agency and that hope back. The third scientific research that I want to look at is from Cooper and Alley, and it's showing that it actually helps reduce depression and anxiety. And I think those of us who have used this type of therapy for some time know that this is true. Nobody really likes to go to the hospital, at least most of us don't. And I think that, most people have a level of anxiety. We're away from our loved ones. We're away from our normal routine, at least. And then on top of it, we're not feeling well. This can cause people to, just have some issues when they're in the hospital of increased depression and anxiety. And we want people to be able to, as we go back again, we're dealing with the body, but we also have to deal with the mind. We have to deal with the heart. And so with solution-focused brief therapy, we are able to assist in that manner, because it's not putting down the medical staff. The medical staff are doing a wonderful job. Our medical staff here at the hospital, they are caring, compassionate individuals, but there's only so much they can do. They're running from one patient to the next and working on what they can to deal with their physical issues. And so that's where we come in with solution-focused brief therapy, and it's allowing us to be that extra support to get that synergy going to help the patient move their healing in a positive direction. Any comments from the interns so far? Additions. I told them they can jump in anytime, and I want them to because they're an integral part. I want you to know they are an integral part of all of this. In other words, I've thrown them right in, right? I've thrown them right in to do the work here. Okay, so a little joke here, right? Because, you know, and it's not making fun of what I like to call the traditional therapy, because traditional therapy, you know, it has its place and it is effective. But when we're in a hospital situation, when we're in a situation where we, you know, everything is time, you know, the time is very, very limited with the person that we are dealing with. This is important for us to be able to take care of that time and deal with it as much as we can to help that person get onto the path of healing. One of the main reasons why I started having interns work on the med floors. There is a saying that I have is I prefer to ask for forgiveness and then ask for permission, because that's one of the reasons I started having interns go onto the med floors. I wanted to do that because we have patients that sometimes people will mark, for lack of a better word, as difficult, right? There may be people who don't want to have certain medical tests, or they may not want to have certain prescribed medical treatments, or they don't want to talk to the doctor, or they are crying all the time, or we can make the list go on, and then no one knows what to do with this patient. And then their treatment is stalling, right? Their progress is stalling. They're not moving on in a way that is going to help them feel better. So when we have been able to move solution-focused brief therapy into the picture, that synergy, those wheels are starting to move because we are adding the energy of positivity. We're adding the energy of solutions. We're adding the energy of finding what's going on with that person. And I am going to, you know, definitely have the interns talk about their experiences, because they can, you know, talk to their own experiences with dealing with individuals here at the hospital where they have seen these things happen, and seen that, you know, we have been able to assist in someone's healing by assisting them in in being able to move that synergy of their feelings. So let's talk a little bit about our setting, okay? We are in the south suburbs of Chicago, all right? So we are in the great state of Illinois. So we are a suburban area from a major city. So we are kind of in between urban and then a very, very rural area. The area that we are in has some very affluent communities, and then it has some very impoverished communities. So we have some very different needs that come to us in the hospital. We aren't very small, but we aren't that big. We have 244 beds to our hospital. Our hospital recently, in the last 2 years, did get an inpatient psychiatric unit added to it. So that's another component that we're able to provide some of our services as well too. We only have adults, so we provide these services only to adults. The average age of our patients is 37, so we do have an aging population. We have a very multicultural population in the South Suburban area. If I remember the mix correctly, I believe we have 46% African American and 42% Caucasian, and then 13% Hispanic. So we do have a multicultural population here as well. So that tells a little bit about our setting that we work in here. So how do we get patients? How did we get to this point? We're going to talk a little bit about that. So how we got to the point where we are today is, as I said earlier, I asked for forgiveness rather than asking for permission. I started to train interns on solution-focused brief therapy, and then started introducing on having them work with patients that we had on the med floor who were waiting for inpatient psychiatric transfer. These were patients who were not medically cleared, so they were in need of some therapy while they were waiting to go to inpatient psychiatric transfer. And so we had great success doing that. And this was recognized. And so from there, it got accepted within the hospital. So from at that point, and we started to see it. It was started to be seen as something that could be done on all medical floors. So now case managers, psychiatrists, we have our psychiatrists here. They are telehealth, so they see patients throughout the hospital, so they will send an order for us to see patients, nurse practitioners, physicians. They can send us an order for us to go and see the patient. And then we will go to their room and we will talk to them and inquire if they are interested in participating. And so that's basically how we got where we're at and how it's going. And we'll talk a little bit more about how it's going so far. So what kind of issues do our patients present with? So as I talked about earlier, some of our patients are going to be presenting with psychiatric issues. Now, we do not, this is excluding patients who are psychotic, okay? So if there's any level of psychosis, we're not going to meet with them because that would not be something that would be helpful to the individual. However, we have people who may have had a suicide attempt. We have people who may be depressed. We have people who may be dealing with a mood disorder. So all of these issues are issues that we deal with when the person is on the med floor. Some of the issues we don't know exactly. We may have just someone labeled as they're not compliant with the treatment, or they're difficult to speak with. They're, not wanting to participate in treatment. And so when our interns go and talk to them and the patient agrees to participate in the treatment and they begin to participate, we will then find out that there is a grief issue, or we will begin to find out there is a issue of trauma, or we'll begin to find out that there are some unmet needs emotionally going on with that person, or that there are relationships that have been broken or terminated, and that person is grieving those relationships. So there are many different things that will be discovered. They may, as we know many times in counseling and therapy, it's not always what we may see it may just reveal itself as it comes. So that's another part of it. We also do have, I would say that probably 50% of the people that we do see are above 50 years old. And so there are a lot of issues of aging that are happening as well. People who may have a terminal illness, may have cancer, may be dealing with those issues, may be dealing with having to give up their independence and what that's going to look like for them. And so working with them on, looking at solutions for that, looking at how to maintain hopefulness, right, in the face of that. So they present in many, many different ways when it's not always exactly the depression or the anxiety or the difficult that is referred to us. And it is a variety of ages. And I know that when our interns talk, they will talk a little bit more about, their experiences. I know that we have also met with individuals. Individuals can meet with us alone, just the therapist and the patient. We do also offer that if they want it to be family therapy, if there is family at bedside and the patient wants them to be included, we do include them as well. I also want to look at this, once again, that, there's the healing part of being in the hospital, right? That we're working on healing the body. But sometimes, we're not working on the head or the heart, right? And so if that part is not being attended to, are we really getting the whole healing? And so adding the solution-focused methods on our medical units has helped significantly. One of the things that I noticed before we introduced our interns, because one of my jobs was to monitor the patients that needed interventions on the medical unit. So for instance, if there was a behavioral health response, as we call it, someone was in a crisis on a medical floor, it would be my responsibility to go and attend to that with other colleagues. And so in doing that, 9 times out of 10, it was an emotional need or communication need, or something was miscommunicated in some way, or we are not understanding something that the patient is feeling about their life outside or after they get discharged from the hospital. So if we're looking at the hospital medical model only, the patient can feel disenfranchised because they don't have the control. They're in a bed, they're not, they don't have control over their food, they don't have control over what they're taking. Someone is assisting them to walk, someone's assisting them to go to the restroom, right? If they're elderly and, they don't have family coming to see them, or they don't have family, someone can feel lost, right? They can feel like, what's going to happen to me next, right? They can feel like they are very alone. I have seen that many times when I've gotten referred to a patient who is depressed, who is elderly, the real issue is what's going to happen to me, but they were too afraid to ask a medical professional that. And so in using solution-focused brief therapy, we were able to really bring them to a more positive, optimistic view, right? That, this is only temporary, and let's look at what's your next step? What what is the discharge plan looking like? Where are you going? All of those things. So it is something that assists with that. And then that loss of hope, gaining the hope. Hope is something that I believe is a healing point for many people. When we lose hope, there is so much that is lost with it. So definitely solution focus reignites that in many people, and it is part of the healing journey. So how I know I talked a bit about it. I've touched on the subject a bit, but so our program is set up in this way. We have graduate interns trained in solution-focused brief therapy. So they do participate in an 8-week training here with me before they are able to go and see patients, and then I supervise them. It is individual or family therapy, and it is 1 to 3 sessions. Now, I will say it could be longer if the individual is here longer and desires to do it longer, but it would not be longer than maybe 8 sessions. And then participation is voluntary. If the person says, I do not want to do this, we tell them have a great day, and we don't make them do it. So we're going to talk a little bit now about the solution focused methods in crisis settings. So part of what we do here at the hospital is dealing with crisis situations. So those crisis situations are definitely including on the medical floors, in emergency room, and also those individuals who are awaiting placement. I know I touched on that, excuse me, a little earlier, that we have individuals who are awaiting inpatient site placement. Excuse me. So sometimes those individuals, excuse me, got a little dry throat here. They may get into an emotional crisis while they are waiting. And so one of the things we will do is we will try to utilize, if the person is able to participate, we will try to utilize some solution focused brief therapy so we can avoid a behavioral health response, so that it can terminate in a more positive manner for the individual. In addition, we do have patients who present in psychiatric crisis or other crises. I mean, we have socioeconomic crises. People arrive to our emergency room with people who, may not have shelter, may not have anything to eat, may not have their medication. There are a multitude of things they may be arriving with. They may be arriving to our emergency room intoxicated on drugs or alcohol. So when they are able to participate, we may engage them in solution-focused brief therapy as well. So those are some of the areas that we utilize these methods as well. So at this point, we're going to have the interns experience using solution-focused brief therapy. All right. So I think when we talked earlier, this is when we talked before you all got on here, we're going to start with Jacob. Just want to remind you guys, don't use any patient names, okay? For HIPAA and privacy. But they're going to share a little bit. So they're going to share a little bit about their experiences. Remember that they're each kind of at a different level of where they are in training and experience in this, but just want to give you a little idea of how it's been for them. So I'll turn this over to Jacob.
Thank you, Christina. Hi, my name is Jacob. I'm talking about a female patient aged 72 on a medical floor. She was in having GI issues, trouble sleeping, eating, vomiting. To determine it was mostly psychological at the end. This patient had come in and was at the time diagnosed with a new cancer diagnosis. She had been in remission for many years, and she had just recently lost her son who passed away on Mother's Day. Um, because of the cancer coming back and being no longer in remission, combined with her son's passing and the depression and other psychological concerns that came with that, our patient was no longer interested in any form of compliance for future medical care for her cancer. In brief solution, when I had an opportunity to sit with her, we decided to discuss what was at the core of things. And when discussing she discussed, excuse me, I'm saying that word a lot. She brought up the fact that she had lost her faith. So briefly in that moment, I thought of the first such idea would be to call the chaplain, so we could address that. She had lost her will to live at this point for her comments, and I was trying to inspire some hope. And she had a connection with the church, so that she had lost. So the first idea was to have the chaplain come up. Upon the chaplain coming up, patient spent time with him, and the chaplain gave her a Bible. Um, she was very pleased. The second time I met with her, she was showing me the Bible, asked to open it, in which I asked her to tell me a couple of her favorite passages. She then went on to read those favorite passages with a giant, incredible mood change that was noticeable. After that, we went to the next solution, which would be to get her to be compliant with her future health care and what she might be interested in doing. After the connection with the chaplain and the Bible verses, she decided she would be setting back up to go to church, where she had connection and many, many people, support system that would be taking her to her future appointments to deal with her newly diagnosed cancer. We also then discussed her social life and as well as her cognitive and how she was feeling functions. She mentioned that she had had previous time in therapy, which she was a big fan of, but because of the recent traumas in her life, she had become non-compliant with going to see her therapist. In this brief solution process and session, we concluded that she would return to therapy, would return to church, and then through those two sections, she would be able to deal with their bigger issue of her cancer and her cancer treatment. This patient wound up leaving very pleased, cried quite often during our time at the end to say that she was very happy and that she had gotten her hope back and that she felt that she could maintain these appointments and felt that she had a fight left in her. And that was that.
Okay. Thank you, Jacob, for sharing that.
Yeah, a little bit.
Okay,
into
whoops.
that.
Hold on, let me get us back on. Here we go. All right, so Felicia, let me get it.
Hi,
Is it
everybody.
focusing on Felicia? Here we
Yeah.
go.
So, I'm Felicia again. I just wanted to shed a little light on that. At this part of my training, I am on week 2, but I have got a chance to observe some short, brief solution focused therapy. And what I like about it the most is that if you notice the gear in the picture that was in the previous slides, that's how I like to view the brain when we are thinking about our thoughts, feelings, and emotions, and how everything kind of drives each other and one feeds off of another. So with that, we are really coming in as a personable approach and making the person feel like they have someone on their side. And that is the major part of it that I like, because being in a hospital is a hopeless place. A lot of the times our family members don't come and see us as much as we like, or they don't have the answers for us. And we can't think about the answers for ourselves at that time. So with that short, brief solution focused therapy, it's helping you identify what is that major need that you want, that most immediate need, and give you some insight on that for you to start working on and set up yourself to be more successful when it is time for that more traditional therapy or when you're going into the next step. So that is really what I appreciate the most about it and what I've been learning about. especially the different questions that you can ask to help draw those answers out of the patient. Because a lot of the times they do know their own answers, but it is so much distress going on around them that they can't think about that. How can I think about what am I going to do when I'm discharged, when I just got this big diagnosis? Or I just found out that I had bipolar. Like, your world shifts upside down in that moment. So how can we get you out of that moment and assist you with identifying what your needs are? And really, that is the biggest takeaway from this format of brief therapy. And we're in a situation with our patients where we are very short term. So how can we set you up in this short period of time to get you to the next step? So that is my takeaway from short solution focused brief therapy. And yeah, it is, I have seen and observed it to be very effective and been able to see patients, laugh when I did an observation with Jacob and even the stories that I hear from Jacob and Alejandra and another one of our interns that are with us. It seems that patients really benefit from that and they want to engage again if they're still in hospitalization with us. So that's the good thing and the great takeaway from it.
Okay, thank you, Felicia. So we'll go to Alejandra.
Hello everyone, my name's Alejandra. I have finished the training and I have been seeing patients for a couple of months now. My first patient was a male patient that was in his early 40s, tried overdosing, was in the medical unit waiting to go to inpatient, and it was causing him a lot of anxiety that he was still there, that he wasn't fully medically cleared to go up to our inpatient. He was hearing voices, negative ones that impacted like his self-esteem, and it was overall somebody that was very hopeless. He didn't really see any point in like living, saw himself as like a disturbance and an inconvenience to his family. So it did take a little bit of like time to work up to realize that everybody has like mental health problems and that there's nothing wrong with asking for help, especially with your family. So that was something that we were able to kind of navigate, and to realize that is something very normal to be able to talk to your family about, especially him having an older brother that was quote unquote more successful as him, and navigating that there is more to his life that he can do, something more fulfilling. We were able to kind of navigate the fact that he can start writing books, something that he always wanted to do, start his own small business, something that he did at one point before having these mental health problems. So that was something that we were able to come up with, and also realizing that journaling was also another way to be able to vent out his emotions. And in our second session, pretty much catching up on like, what was on his mind, like if the journaling has been able to help him, if the reading has been able to help him. And thankfully he said that it was helping him to pretty much come up with conclusions and own solutions for the problems in his life. And ultimately he realized that that this is his life and that he's able to take control back. So that was a really good interaction that I had with the patient.
Okay. Thank you, everybody. That's great input. So, you can hear some of the, from the interns, their experiences. I think the greatest part that I can hear is that, the interns have had some wonderful therapeutic experiences. They're walking away with some great therapeutic tools. They also are doing a great impact on the community here as well. One of the things that I think I didn't mention earlier is that our community does not have a great resource of mental health community mental health resources. And so a lot of our patients do not have that accessible to them. And so to be able to come here and have a therapist actually come to meet with them, a therapist that actually is caring and, finding some type of, hope and solution and, gaining some type of positivity for in their life while they're here is something that is unimaginably important for the populations that we deal with. So I think it's some very important work that our interns are doing here. And I'm very proud of the team that we have. And I'm really proud of the work they have done. And I think that the patients and the family of the patients have made a lot of great comments about how this team of interns has helped them this year. So great job, everybody, and thank you for all of your hard work. Okay. So I don't know if we have anybody actually with us here, but are there any questions, comments, um, any discussion, any thoughts from the interns themselves while we're on here?
I think the introduction of this format of therapy was very necessary during this time because it is a lot going on. A lot of our patients have, like, economic disparities. They have health issues, they have psychiatric issues that they're working through. And yes, resources are very sparse and in between with the population that we serve. So just being able to go in and have that conversation with them and help them get through those tough times, I believe is very beneficial to what we do. Especially with the questions that I ask, like, because if somebody walked up to me and asked me if I had a magic wand to, like, give me everything that I need, I can tell you a list of things that I need.
I'm sure, Felicia, yes.
We can all think of a few things that we
Right.
will need, right?
Uh-huh.
And we can build off of that
Yes.
to help them identify what is the first thing that they will really want for themselves and expound upon that. And that is a game changer right there, because it is small things that we don't think about. And, it helps pull it out and serve for the best interests of our patients that we work with.
Great, great. Thank you, Felicia. Anybody else have any other comments?
I'd say I'm a giant fan of this, and I do realize sometimes have both short-term and long-term problems in life. But from experience and over the different years and different life experiences, I realize that a lot of times people will not get to the short term, or I'm sorry, the long-term treatment before they get to the short term. So I find this to be the kickstart that many people need, that without they would not be looking to secondary treatment or going to maybe substance use treatment, or going to follow up with their cancer diagnosis and the chemotherapy and things that come with that. This is the benefit of this, in my opinion, as well.
Great, great. Thank you, Jacob. All right. Okay, well, thank you for attending our presentation, whether you were here in real life or you are looking at the recording. We appreciate you and thank you so much. Okay, here are our citations and we thank you so much. We're going to stop sharing here. Okay, and thank you all very much. Have a great day, and that's our presentation.
Thank you.